I want to welcome you all here. It's really nice to be here. And I want to thank Alex for giving me the opportunity to speak about something that I'm very, very passionate about, and that's health. And I truly believe that people can achieve vibrant health. I think it's not beyond our capability. It's something that's really our birthright. It's something that we have a right to, that we deserve to be able to feel truly healthy. And unfortunately, the way the current healthcare system is structured, it unfortunately is not going to be gotten there. I mean, I've asked this question in different places before. How many of you think that current conventional medicine can make us healthy? Yeah, I'm already preaching to the choir. You can all go home. You heard it all. No, it's true. I mean, I think it's truly amazing. I mean, truly, this is a self-selected group. People come here, they know that they're not going to get vibrant health from going to a doctor. It just doesn't happen. You know, you may get your cholesterol lowered, you may get your blood pressure lowered, but that's not the same as being healthy. And we seem to have lost that. The general public, and particularly the conventional medical doctors, seem to have lost that concept, that idea that we're not doing anything to make people healthy. And this is just an aside. We'll get into this a little bit more if we want to, but our healthcare system is absolutely beyond repair. The national debate is about who's going to cover healthcare and whether it's going to be universal coverage and who's going to be forced to pay, but nobody's talking about what's being delivered. Our healthcare system is broken, and no matter who pays for it, there's not enough money in the entire universe to pay for what's to come with our healthcare system, because the way we eat is poisoning us. Everybody's getting sick. The drug companies are making lots of money giving us drugs to keep us feeling a little bit better while we're chronically ill. They're not making us literally well. They're making us feel a little better while we're chronically ill. The food companies are perfectly happy to keep us chronically ill as long as we eat their junk. And our entire lives and everything just gets worse and worse. And then what's medicine's idea? More drugs, more expensive tests. That's just going to keep on escalating. So it doesn't matter who pays for it. It really matters what's health care. And that's what I'd like to hope is that people can wake up to the idea that there's a different way of taking care of our health, and that we can truly be healthy. And it's not going to be out of a pill bottle. Okay. I've given this talk before, the 6 pillars of vibrant health, and I just walked by one of the booths and I saw somebody wrote a book, 7 Pillars of Health. I can't win. So I don't even know if I can give this talk anymore now. First of all, somebody's written a book already, and they've gotten one more pillar than I have, and that's, So after I saw that, I thought I might change the name of the talk in the future to evolutionary health or evolutionary wisdom, because I think that we can actually become the masters of our own health if we start to look at the lessons of our genetics and our evolution. And what do I mean by that? Well, for 2.5 million years, we lived in a very stable environment as far as our food was concerned. We were basically hunter-gatherers, tribes that were living on the earth for 2.5 million years of humanity were hunter-gatherer tribes. Mostly they were gathering vegetables that they could find, fruits from the trees that they can find, and probably hunting wild animals. But these animals were not stuffed into feedlots stuffed with grains. They weren't fattened. They were actually grass-fed. They were wild animals, and they were pretty lean. We might have fished for wild fish. So we had this lifestyle, and there's nothing, inherently good or bad about eating that way. But this is just the way it was. And because that's the way it was, because of survival of the fittest, our genetics over 2.5 million years became more and more and more suited to that way of living. So I'm not advocating going back to some kind of idealistic world of the past where people are hunter-gatherers. I'm sure that life was really hard. When I sit down at night and I have my remote and I'm relaxed on my couch, I'm thankful that we have a civilization. But if you have those ideas and that knowledge in your background, you can actually learn to apply those and increase our health by looking at our past, looking at our genetics. And there's nothing that we can say about our genetics that'll change it. There's nothing that we can point to. We can't say, well, culturally we ate this way for, my family's been eating this way, and my ancestors have been eating this way for a few thousand years. A few thousand years doesn't cut it as far as evolution in our genes. We started eating grains about 10,000 years ago when farming started. It started in different places all over the world. But generally speaking, it wasn't until about 10,000 years that we started farming. And it also wasn't until 10,000 years ago that we started to domesticate animals and started to have dairy. So there was really no dairy in our lives and no grains. Now that doesn't mean there's anything inherently bad or wrong about dairy and grains. It's just that our genetics are not particularly suited to eating that way. So what's the lesson of this? When I talk about the 6 pillars of health, I talk about diet, I talk about supplements, I talk about stress management, I talk about exercise, I talk about toxins and detoxification, and the last is bioidentical hormones. How does that relate to evolutionary wisdom, to evolutionary health? Well, I try to weave each one of these pillars around the concept of what's best for our genetics. What is the wisdom of our genetics, and where does that take us in terms of how does it inform our lives? How does it point the direction of how we should live? And let's start with the diet, which I've already started to talk about. If our diet was a hunter-gatherer diet for 2.5 million years, and our genetics over that period of time, that long period of time, became ideally suited to that way of living, to that diet, that's probably going to be the most healthy diet for us. Now, because my wife's Italian and she used to make pasta and her whole family eats pasta and the culture is around pasta, that's great and it was delicious, but it's not necessarily the best food for us and maybe not the best food for anybody. When I first heard about this diet, I thought about this. I said, that's pretty extreme, this hunter-gatherer diet or the paleo diet. There's a book, by the way, that we had out in our booth called The Paleo Diet. I highly recommend it, by Lauren Cordain. Dr. Cordain is a PhD researcher in this field, and it's a very well-documented book. I actually first thought it was very extreme. And it actually is extreme when you look at what's being advertised and what we're bombarded with in our lives today. But most of what is advertised for food is not really food. Most of what we see in a supermarket is not true food. It's really just stuff that's called food, that's put into packages. It's not anything near this whole food that we used to eat as a species. Now again, it's not a moral issue. I'm not saying that there's something evil about the way that people are eating these days, and there's nothing wrong with making an ethical choice to be vegetarian, for example, or vegan. The issue really is, what is our ideal food for our genetics? And no matter how we wish it away, we can't change our genetics. Our genetics are pretty much fixed now. Now, if we survive for the next 1,000,000 years eating Fritos and Fruit Loops, it could be that Fritos and Fruit Loops will be the perfect food for us. It really could be. Of course, by that time, they'll figure out some way to make money out of something else. And something else will be challenging our food. But right now, 10,000 years hasn't been enough time for us to change our genetics. And that means that really we need to look to that ancient way of living as our ideal food.